This is CBS 12 News at 5.
COVID cases spiking in our schools just days into the new year, and the Palm Beach County School Board dashboard shows 37 students and 14 employees tested positive for COVID-19. The cases were reported across dozens of different schools. So far, 440 Palm Beach County students have been quarantined over the first 2 days, either for exposure or symptoms. Nearly 7,000 students opted out of wearing masks.
As COVID cases continue to surge, doctors are seeing more and more kids heading to the hospital, and some of them are so sick they need intensive care. CBS 12's Lena Salzbank speaks with a pediatric cardiologist about COVID's impact on a young person's heart.
6 months ago, I was seeing 1 or 2 cases a week. Now I'm hearing about 1 or 2 cases a day.
Dr. Carlos Zeidenweber is a pediatric cardiologist working in 4 hospitals across Palm Beach County. He's called to consult on nearly every COVID case that involves a child to make sure their heart is okay.
Most of the cases that have COVID don't have heart involvement. We have seen kids who have decreased heart function, or some of them behave a little bit like Kawasaki. We see sometimes fluid around the heart.
Now, I'm not a kid, but I hopped on the table and got into a gown so that we can show you what it would look like if you were affected by COVID-19 in the heart.
I can put some color and see if any of the valves are affected. When you ask me what's the most common thing I see, is that the heart function, instead of beating at 55%, it's beating at 20% or 30%. You just got an evaluation and your heart is working perfectly fine.
And while my heart is functioning at 100%, young people with COVID-19 are not always as lucky. The West Boca cardiologist is encouraging all kids who are eligible to get vaccinated.
The benefits of getting the vaccine severely outweigh the risk of the heart inflammation.
In Boca Raton, Lena Salzbank, CBS 12 News.